Hello guys, my name is Reem Jaber and today with my colleague Mariam Sour we're going to be showing you guys how to use two databases, Medline and PubMed, when it comes to evidence-based medicine. So we're starting with a brief introduction about the topic. What is EBM? So EBM is a conscious, specific, reasonable way of using modern available research information when it comes to making decisions about the care of individual patients. So it's not developing new knowledge or validating the existing knowledge, however, it is translating the evidence so that it could be applied to clinical decision making. So EBM is divided into 7 steps that we're going to be seeing in this presentation. Step number 1 is formulating a question that we call the PICO question. But first, what is PICO? PICO is a process format for developing a good clinical research question prior to starting one's search. So the aim here is to make our search clearer and more organized, and it's usually based on a scenario. In this case, I gave you the scenario. Nada is an 16-year-old teenager trying to quit smoking. So she visits her physician to ask about 2 therapies. The first one is the behavioral therapy, the cognitive behavioral therapy, CBT, and the other is the nicotine replacement therapy, NRT, and she wants to know which one is more effective. So the question, or the developed question here, is going to be, in teens trying to quit smoking, is treatment number 1 more effective than treatment number 2? This step makes identifying the keywords for each PICO element very, very easy. So we're starting with the letter P. It stands for the patient, population, or individual that we are going to be studying. In this case, it's teens. We move to I. It stands for intervention, treatment, action that we're considering. In this case, we want to know if CBT is more effective than NRT. So we have a comparison. And C stands for the other treatment that CBT is going to be compared to, which is NRT. The outcome is quitting smoking. Moving to step number 3, we should select the best study design. So are we going to be discussing therapy? Are we going to be talking about the diagnosis, the etiology, the prognosis? In this case, we're comparing 2 therapies, so of course we're going to be going with therapy. And we're going to see how we're going to incorporate the therapy into our search to limit it, to make it easier for the physician to answer Nada. Step number 4, it's searching the literature, and we have multiple databases that can be used now. However, in this video, we're going to be talking about Medline, and in part 2, we're going to be talking about PubMed. Step number 5, refining the results. 6, reviewing the literature. And 7, assessing the evidence. So now we are going to be moving to Medline and how can we use it. So when we first open Medline, this table here is going to open, and we have to pick the one here because it actually includes the highest number of articles, because as we can see here, it's from 1946 to November 2, which is the closer to our date today. So we press on that, we go to continue, and Medline is a very smart database. So instead of going to search for keywords, we're going to be searching for something which is called the mesh. But to search for the mesh, we have to make sure that this button here is clicked. And after selecting our PICO elements, we're going to start by researching the first PICO element, which was teens or teenagers. We press teens, we go to search. We're going to see here, we have a button called explode and a button called focus and scope. So we have the word adolescent. If we don't know what it means, we press on scope and it gives us a brief definition in addition to some other used words or synonyms. So after making sure that it corresponds to our word that we're searching, we can pick it. However, the button explode means that it's going to take everything that's under the word adolescent when it comes to the tree that we're going to be seeing right now, and focus if we want the research to be, or the articles to be, very focused on adolescent. Always, always, always press on the word on the mesh to see the tree. Here, we can press on the word explode because there is nothing actually under it. So always make sure. And if we don't press, it's the same. Okay, so there's nothing under it. We make sure that it corresponds to our search. Here it says it's a person from 13 to 18 years old. Yes, it matches our search, we press continue, and it's going to show us a list of subheadings. For now, we're going to include all of them because I'm going to be incorporating therapy as a limit when I finish my Medline search. Press continue, and here it's going to be showing us the results, and to display the results, you press right over here. Moving to PICO element number 2, which is the first treatment, the cognitive behavioral therapy search. It's taking a while. I think my internet is not that good. As I showed you before, to read more about it, we press scope, and always press on the mesh to see their corresponding tree. This is what I mean by everything under it. So as we can see here, we have acceptance and commitment therapy, cognitive restructuring, and mindfulness. After reading about them, yes, they all belong to my research. So I'm going to be pressing explode. Thus, instead of like pressing all these or ticking all these, it's enough to just tick the word explode over here. Continue, include all subheadings, continue again. And then we are moving to our third PICO element, which is the nicotine replacement therapy search. So what is nicotine replacement therapy? It is actually devices like gums, like patches that are actually used to help a person stop smoking. So as we can see here, there's no mesh labeled or named as nicotine replacement therapy. So we're going to be looking at the list here, and we're going to choose what's closer, what corresponds to our PICO element. So it's not quitting smoking, it's technically mainly the devices that we could use to stop smoking or to reduce smoking. So we press on that, we go to the tree, and yes, nicotine chewing gum also corresponds to our search. Of course, to read more about it, we head to the scope, we press continue. Also, I'm going to be including all subheadings. And we're done with our third PICO element. The fourth is quitting smoking, which is the outcome. So technically it's all just a repetition, but it's very important to read the scope and to press on the mesh to see the tree. The tree here is smoking reduction and tobacco use cessation and treatment adherence and compliances. Yes, so here we have the plus sign. It means that we also have other trees under this here. So we press on it. So it's going to show us the tree here. Patient satisfaction, treatment refusal, they don't actually correspond to our search. So we are just going to be like going back, and we're going to be selecting manually these two that correspond to our research, okay? That's why it's very important to see the tree, because sometimes you might tick and you might end up getting irrelevant articles or information. So now we need to combine all the four elements. We can combine either by using and or. In this search, we want the articles to include all four PICO elements, so we use and. So when do we use or? We use the word or, for example, if we found two meshes that correspond to the same word, then we press the word or. So in our case, we got 11 articles. We're going to plus display the results because we can make them more like, we can limit them more. How do we do that? By adding a limit. So we press on additional limits. We wait for like a minute. We get here clinical queries. We go to therapy. We can either choose between these three. Sensitivity is when we get all the articles, is when we make sure that we're not losing any article even though it's not relevant. The specificity, it reduces the number of articles, but sometimes we can also use relevant. And of course, as a physician, we go with maximizing the sensitivity, and then we limit the search and we get the finalized number of articles so that the physician can look through them and answer nada. So we end up with 9 articles, and we press on display the results. We're just going to be waiting a minute because of the internet. And here they are, the 9 articles. Thank you guys, and I hope you actually learned from this video.